Hello, all the panel. I am Dr. Tanushree Mandal. I am the moderator of this session, and we are really very happy to be having you on board. So I just like to share my slide and show you the ground rules. So yes, so this is the EN-55 Innovations for Capacity Building to Address COVID-19 Strategies from the Momentum Projects. So what we want to do is that we request everyone to participate actively, and we want all of you to write into the chat portion where you belong, which city and which country, and also at the same time we would request only the panelists to ask to share audio and video, not everyone, because that will prevent the jam up and the other problem. So would request only the speakers to join the panel. Now the session includes presentations from the speakers, and at times we have the poll questions, and following that we have the question and answer sessions. So these are the resources for the speaker slides. And amongst us, we have the esteemed speakers, Rebecca Fields, Meru Sheel, Laura Shimp, Chizoba Bonodi, and Ale Blaze from JSI.
Can you hear me now? You can.
Yes.
Excellent. Wonderful. So can we please share the screen? Chizoba, could you please share the screen? The slides, rather. And I'd love to welcome everybody who is joining us today. Thank you so much for joining us. And I just also want to make a correction here. As you'll see on our first slide, when Chizoba is able to get that up, that in fact only a few of us are from JSI. And in fact, we are here on behalf of the different projects within USAID's Momentum group of projects. Let's see. We will need Chizoba to get the slides up. Okay, great. And I'm wondering if there's some way to minimize so that we can actually see the slides easily. I am not able to do so. Anyway, so just with the first slide here, I just want to say that we come from different Momentum projects. And we'll go through the list of panelists in a moment. This is going to be a panel discussion in which we're discussing innovations for capacity building to address COVID-19 with strategies from the Momentum group of projects. This will be a panel discussion, but we also want it to be interactive. And for that reason, in addition to contributing to the chat box, we are going to have some questions for you to answer, multiple choice questions. We will start with one in just a moment, and then we will have you answer them. For those of you who are on Hop-In, you'll be able to answer the questions using the poll function at the right-hand side of your screen. So let's start with the question. Next slide, please. So the poll question here is, what do you see as the biggest challenge for capacity building for introducing COVID-19 vaccine? Please just choose one response in the Hop-In poll. And we'll give a minute for that. We're going to save the responses for each of the questions to our question and answer session a little bit later on. So let's just take a minute to answer this question, and then we'll move on to the next slide. And Alain Blaise, if you see that there are any problems, please just let us know about the questions.
Thank you so much, Rebecca. I will ask Tanush, the moderator, to make sure that the poll is seen. And I'm not seeing the poll.
So Alain, if you have to see the poll results, you may have to actually answer the poll to be able to see, because you are on the panel, and it will be the same for all those who are on the panel. And for those who are in the room, just to help you out, the poll is just after you click on the icon, polls just after the chat, so that you'll be able to.
Yeah.
Thank you very much, Charlotte. So all of you, we have 1 minute to go to the poll. So if you look on the right side of your screen, you may see the question, what do you see as the biggest challenge for capacity building for introducing COVID-19 vaccine? So you have option. So we have 30 more seconds left before we close that poll. Remember that you do have 4 questions. So we are starting just with the first one, and we will have 3 more. So now we are tasked to answer the first one. That is, what do you see as the biggest challenge for capacity building for introducing COVID-19 vaccine? Thank you very much.
And please don't type in the chat, just click on your answer. Don't type the answer in the chat. Just click on the answer you are choosing. That will be, and then for Rebecca, you said you wanted to see the slides better. So if you just look at the top right corner where there is 500, the numbers of persons are 529, there's a little arrow. If you click on that arrow, it will mask the chat, and you'll be able to see the PowerPoint.
Okay, great. Thank you so much. Okay, I think we need to move on in the interests of time. So just, Chizoba, could we have the next slide, please? Great, thanks. Okay, so I just want to introduce the Momentum suite of projects. This is a group of innovative projects funded by the U.S. Agency for International Development to holistically improve healthcare services, maternal, newborn, child health services, including immunization, voluntary family planning, and reproductive health services in partner countries around the world, with the aim of accelerating reductions in maternal, newborn, and child mortality and morbidity, increasing the capacity of host country institutions and organizations to introduce, deliver, scale up, and sustain the use of high quality services and practices. And these projects, it's a group of several projects. Some of them started about a year ago, others have started more recently, and they will go for the next 5 years. Next slide, please. So there are several Momentum projects that have an immunization component within them, and we'll be hearing from several of these projects in this session today. I'm not going to go through in great detail about each of them, but just so you can see them all here in kind of one place, that we've got Momentum Country Global Leadership Project, we have Momentum Routine Immunization Transformation and Equity Project, Momentum Integrated Health Resilience Project, working specifically in fragile and emergency settings, Momentum Private Healthcare Delivery Project, harnessing the potential of the private sector, and the Momentum Knowledge Accelerator Project, which works across these different projects to provide support in harmonizing our data, synthesizing our learning, and supporting strategic communications. Next slide, please. So as we all do work in complementary ways in somewhat different settings, although we do share work in immunization, we're all working in immunization, we all also share the same goals and results that we are trying to achieve. As shown here, we're trying to scale and sustain access to the use of high quality services and build capacity to deliver evidence-based high quality care. We're trying to increase adaptive learning, learning as we are going, and really increase the use of evidence to try to keep continuously improving services and increase innovative partnerships and collaboration between those of us working in healthcare and in other sectors. I just want to introduce today's panel in our next slide. So my name is Rebecca Fields. I'm the Immunization Technical Lead for the Momentum Routine Immunization Transformation and Equity Project. We have with us Dr. Chizoba Wanodi, who's the Immunization Lead for the Momentum Country and Global Leadership Project. We have Laura Shimp, Immunization Senior Advisor on the Momentum Integrated Health Resilience Project. We have Dr. Meru Sheel, working on the Momentum Private Healthcare Delivery Project, and finally working initially behind the scenes, but then moderating our conversation, our discussion, Dr. Alain Blaise, whom some of you may know from previous work with the Geneva Learning Foundation, also on Momentum Routine Immunization Transformation and Equity. So let's move on to the next slide. And I'm going to change directions a little bit here to speak about some of the things that we within MRIGHT, the Routine Immunization Transformation and Equity Project, are starting to plan in terms of applying human-centered design methods, root cause analysis, and innovative partnerships to introduce and strengthen COVID-19 vaccination. We all know there are a lot of challenges around COVID-19 vaccination. Next slide, please. So Momentum, Routine Immunization Transformation and Equity, has the goal of overcoming entrenched obstacles to reaching zero dose and under-immunized individuals, not just children, but individuals, by applying what we already know works, applying those best practices, facilitating work at very different levels to co-create new innovations, and also make sure that we are thinking about the systems in which immunization is provided. So those are our big goals overall. Initially, we were set up to reach zero dose and under-immunized individuals, and that remains our goal. But now we also have the challenges with COVID-19 vaccination. Next slide, please. So within our consortium, we've brought together several different groups within the MRIGHT project that bring together capability in routine immunization strengthening, that's JSI up at the top right, development of cross-sector partnerships, social and behavior change, community health systems, human-centered design, which I'll talk about a little bit more in a moment, health system strengthening, and certainly monitoring, evaluation, and learning. So we have different groups within our project who bring these special capabilities. Next slide, please. And certainly we are going to need those capabilities in facing the unique challenges in capacity building for COVID-19 vaccination. I think we all are aware of the many challenges that there are, but I just want to focus on a few of them here that have implications for training and capacity building in different ways over the longer term. So first, as we know, this is a new vaccine, it's unfamiliar, it has been developed very, very rapidly. Now, the implications for training and capacity building are that health workers, of course, must have the skills to provide the vaccine correctly and safely, but they also need to have the confidence to accept it themselves and provide it and communicate with others about it. We know health workers are very, very influential and credible sources of information. So we need to make sure that they are comfortable with doing that, talking about it. And that may mean finding out who influences them and how we can work with various organizations so that health workers themselves are confident and feel supported in talking about and providing vaccination against COVID-19 vaccine. Second challenge on the left here is that we're having to reach unusual priority groups. We don't have typical service delivery platforms for reaching them. So this means for our training and capacity building that we need to build skills for health workers together with communities to jointly develop micro plans to reach these priority groups, the elderly, the infirm, those with comorbidities, and certainly health workers themselves. A third challenge is that we really need to put the priority on vaccinating the most vulnerable populations. Now, in immunization, we've always had challenges with reaching the most vulnerable populations. We can use training and capacity building for COVID-19 vaccination to really reinforce that commitment to reaching the most vulnerable and to continue to build the skills to mobilize for the resources that are needed to reach those most vulnerable groups. It's one thing to have a plan, it's another thing to have the resources to actually carry that plan out. A fourth challenge is that the priority groups for COVID-19 vaccine will change. They will expand as the global vaccine supply increases. And so that means that for our capacity building, we need to think in continuous terms, using blended learning over the next few years to change and adapt as those circumstances with global vaccine supply also change. And we need to learn from early successes and problems. And finally, we need to recognize that COVID-19 vaccination may divert attention away from routine immunization of infants and young children. So we need to use the opportunity of training and capacity building for COVID-19 vaccination to reinforce key skills such as microplanning and community engagement to improve equity for all of our vaccination efforts. Next slide, please. So in terms of innovative tools and approaches that the MRIGHT project is going to be using, we will employ human-centered design methods, such as journey mapping, to understand what is the journey that these priority groups for COVID-19 vaccination and their families will need to go on in order to get vaccination from COVID-19. We need to learn of their perspectives. And similarly, we need to work with them to introduce co-creation methods that bring the health system and local communities together to design locally appropriate solutions that really work within their own contexts to reach those priority groups for COVID-19 vaccination. We need to build innovative partnerships, mobilizing groups who maybe are not usually involved in child vaccination to reach those who are targeted and priority for COVID-19. For example, groups that support the elderly or the infirm. We need to do root cause analysis. With any massive new effort, we have some problems that will arise. Of course, they'll arise. We need to actively learn from them and identify the root causes and address them, and revise capacity building strategies to build problem-solving skills to address them. And finally, we need to build on what does work well and capitalize on that and build it into planning. So let's go to the next slide. And here's the next poll question. So,
yeah, thank you very much.
Over to you, Alain, if you want to introduce the question.
Yes, please. So I would really invite you to really participate in the session. So one way to go about it is to really look on the right side of your screen. You will see chat and poll. Click on poll and you will be able to take all the 4 questions. But now we focus on the question 2 that says, what do you see as the biggest challenge for capacity building for introducing COVID-19 vaccine? So you have 1 minute for your answer. You have options to answer. Please go ahead and click the option that you think is appropriate to your as your answer. So thank you very much. We have 40 seconds left. So please look on the right side of the screen. You will see on the upper top side, chat, poll, and then people. Choose poll, and then you'll be able to participate on the session by answering the questions that are there. We have 4 questions, so now we are talking about the second one that says, in addition to training health workers, who else need to be reached with capacity building for COVID-19 vaccination? So you have to just choose one answer. Thank you.
Great, thank you so much, Alain. And maybe we can advance to the next slide. And thank you, Chizoba, for moving to the next slide. And just want to introduce Dr. Merushil to talk about the Momentum Private Healthcare Delivery Project. So, Meru, why don't you go ahead?
Yeah, thank you, Rebecca, and good evening, good morning, good afternoon, all, for whichever part of the world you are in. I'll briefly present on the private sector engagement for immunization part of the Momentum project. And as you can see, if you could go to the next slide, please. One of the key parts of this particular arm of Momentum project is to look at private sector engagement and immunization within the MPHD conceptual framework, as well as the Momentum project that Rebecca has been describing about. And the key aim, the goal ultimately remains the same, is to, I guess, expand access and use quality evidence-based methods to increase the reach for immunization. And one of the key roles here is to engage private providers in the government schedule and service provision to expand the scope of immunization services, whether it's through service providers, information systems, supply chains, access to subsidized vaccines as allies in the vaccine demand generation and communication efforts. And to do this, there's a couple of different ways. As Rebecca said, one of the ways is, of course, the client-centered care, potentially considering that private providers, especially for profit, may provide models for more client-centered care that integrates the services of that a family or a patient may require. It also aims to use a total market approach that is addressing private provider incentives, including access to government supports to immunization, which leverages Gavi's healthy market concepts for immunization. And also from a localization perspective, every context is different, so public-private mix is very heterogeneous, responding to path dependency of history and the organics of local markets, hence the need to map out different typologies, what the private sector looks like in different parts of the world, different settings, whether it's for-profit or not for-profit, and acknowledging the breadth of non-state actors, as I said, for-profit, not-for-profit, scope and level of organization, and the history of government engagement in the different contexts that we might be talking about. Next slide, please. So in the context of this particular area of work, one of the first key deliverables and areas of work that we're working on is to deliver a technical briefing note for private sector engagement for the deployment of COVID-19 vaccine. And the main purpose of this particular area of work is to inform the current global and selected national plans for COVID-19 vaccine deployment with evidence on private sector engagement. And this relates particularly to one of the facts that, as Rebecca said, as the vaccine supplies increase, what the role of private sector might be in that space as well. So it is to identify new contributions, if possible, from private sector to support vaccination in the medium term, including service delivery, again, health information management, monitoring and surveillance, for both adverse events following immunization, but also for progress monitoring, coverage of vaccination, logistics and communications for confidence and demand. And for this particular area of work, we are taking a both global approach to see what the landscape looks like across low middle income countries in many parts of the world, but also in specific countries, so taking a country-specific case study approach to validate it and assess practical applications. In order to do so, we would be keen to hear from everyone in this panel, but also what we are trying to do is map experts and data sources on private sector engagement and immunization. We're identifying key organizations for interview and doing desktop-based data review, analysis of global guidance documents, and rapid review of recent private sector engagement experiences from organizations or government sectors or personnel who might have been in that space, especially with historical vaccine rollouts like polio, HPV, or other recent experiences. So currently, and as part of this, one of the key body, next slide, please, yeah. As part of this, one of the key areas is to examine the intersection of the 2017 WHO guidance on private sector engagement, which very nicely outlines the key criteria that private sectors can be involved in, along with the more recent VRAF tool for the COVID-19 vaccine deployment. Many of you might be aware that it covers about 8 to 9 pillars across from partner coordination, surveillance and monitoring to healthcare worker training, capacity building, regulatory affairs and governance structures. And the third document being on the right that you see in the blue is the guidance on developing the national deployment vaccine plans. So the idea is to map these three across each other, talk to stakeholders and key informants, and identify what the common themes are, where can private sector play a functional role, not a theoretical role, but a functional role to really increase that immunization coverage to push the 80% to the 100% in areas where public sector might be stretched or might need extra support, and to really foster a true collaboration and partnership between the public and private sector. And that's it for me. And we have a polling question as well, and we'd like to hear from you. Where do you think the maximum impact of private sector can be in the deployment of COVID-19 vaccines? And you can see the options, and unfortunately my screen is really small, so I am struggling to see the options on that we list over there. So Rebecca, if you can see them, would you be able to read them out?
Yes, we can see them very well. So we have 7 options, or 7 options with others. So what you have to do is to click, and if you want, then if you are choosing the option G is other, please go ahead and indicate it in the chat box, we were able to copy that. So we have 40 seconds left for that poll question. So again, we have a set of 4 questions. So the idea you are able to answer all the 4. If you make some, you can go back, scroll up, and you'll be able to participate by giving your answer.
And so maybe thank you so much, Meru. And maybe in the interests of time, while people are responding to the poll, we can advance to the next slide. And Chizoba, it will be you speaking now, right?
Yes.
Great, thank you.
Can you all hear me?
Yes.
Thank you very much, Rebecca. Hello, everybody. I'm Chizoba Wonodi with the Momentum Country and Global Leadership Project. As Rebecca has introduced, this is a partnership of about 12 different organizations led by JPIGO, and my home organization is the Johns Hopkins International Vaccine Access Center. And our role is really to provide the global leadership and country technical assistance to country governments around immunization. So we have a number of projects on our portfolio, but I want to just focus on one of the projects that we are pushing towards, which is quite appropriate for this forum, which is helping the WHO and other immunization global partners to coordinate a learning agenda around what we call Build Back Better. We know that with the advent of the COVID pandemic, health systems have really been disrupted and they've faced enormous challenges. And our immunization programs have had to respond and adapt. And we heard many of those examples in the plenary today, showing how from the ground level, immunization managers, immunization providers, civil society, different parts of the immunization system have responded. And so it's an opportunity for us to learn actually what works and promote that knowledge sharing. Again, in the spirit of what we are all doing here at the Teach to Reach and what the Geneva Learning Foundation is promoting. So this project, therefore, recognizes that even though there's been an impact on health systems, this impact has not been uniform. There is heterogeneity. For example, if you look at this slide, you'll see that after the COVID pandemic hit, there was a decline in coverage, immunization coverage across different countries, but that decline was not uniform. So the taller the bar here, the more the reduction in coverage compared to 2020, comparing 2022 to 2021. So what does that tell us? It tells us that different immunization systems did respond, and we have a lot to learn from each other. And so we know that within the immunization community as a whole, there is a lot of interest in understanding and learning how we build back better following COVID pandemic. And when you think about WHO, UNICEF, Gates Foundation, the global immunization partners, regional immunization partners, even at country and sub-national level, people are interested in this learning agenda. So what this particular activity is going to do is to support the WHO IVB, that's a unit within the WHO Geneva office, to help coordinate this learning agenda so that we have in one place all the different questions that people are trying to answer and the different activities that people have initiated to answer these questions. So we have 3 main objectives for this activity. The first one is to enhance coordination, alignment among global partners. So if WHO, for example, is doing surveys to assess the extent of disruption, we want to have that information in one place so that if you are looking for answers around how much were immunization programs disrupted around the world, you don't have to start your own survey. You can say that there is already somebody doing that. So that's part of the coordination and an alignment. And then based on what different partners are doing, including what we are learning from the country level and the innovations that at the country level that's emanating, we will produce and share learning products, things like case studies, things like issue briefs, peer-reviewed articles, and all that. And then we also want to provide the opportunity for to elevate country voices and promote local leadership for learning. This is really an opportunity for the people at the country level, at the local level to shine, to showcase the innovations that they have brought on board. So it will require 3 different approaches. One is the data collection to really understand what are the questions that people are asking, and then what are the answers that have been provided. Where do we have resources to answer these questions? They will also do a landscape analysis to map who and what is interested in this learning agenda. And then with the results that we produce and with the learning products that we produce and other people produce, we will now have a virtual mechanism to share that. So how can this really be applied? This learning agenda, the case studies and all, how can it be applied? We think that there's actually practical application for it, just as we've seen with the presentations today. I could be an immunization manager in Nigeria, and I'm interested in learning what strategies were employed in different areas to successfully restore immunization services. So I'm in my my country, at my level, I'm developing my plans, and I want to get inspired from what other people have done. I could be thinking about what kind of demand side barriers that have emerged during the pandemic and how were they addressed. I could also be wondering, like, oh, I have this brilliant idea that we've applied in my country, and I think it's something that's worth sharing. So where can I share it? What are the forums that are available for peer-to-peer learning? So these are some of the practical ways where the knowledge products that will come out of this project, as well as understanding the landscape of platforms and partners and opportunities for learning and for sharing, that is what can actually bring value. And so our solution to this is to have a centralized location to aggregate and explore all these learning questions that we've talked about. And then we will also have a centralized compendium of data sources. So if you wanted to look at immunization coverage across the world, we know where to go to. If you wanted to look at innovations around immunization, we know where to go to. So bringing together the different data sources that people can use to answer these learning questions in one place will be one of the solutions. And then, of course, like I mentioned before, selecting some key topics to synthesize and produce into learning products, and then also bringing together, leveraging either existing platforms for learning, meetings, forums, websites to share these learning products, and then organizing and facilitating exchange forums for country, regional, and global stakeholders to share their learning on how health systems have been resilient, how they've bounced back from COVID, and we'll continue to learn even as the COVID vaccine is rolled out. So this, in a nutshell, is the overview of the activity. And now I have a question for you, because this activity is really geared at supporting the immunization manager at the national, subnational, frontline level. I want to find out from you, which of these resources do you find most useful to help you develop or design interventions to address challenges in your immunization program? They could inspire you to now look locally and say, what would be a local equivalent of this idea? So is it case studies of promising programs? Is it peer-reviewed publications of promising interventions? Is it training videos on how to implement a particular program that you wish to adapt? Or is it webinars or workshops to share and learn? I know they are all important, but I want you to just tell me which is the most useful for you. So pick only one. Thank you very much. Alan?
Yes, thank you, Chizoba, for the brilliant presentation. So I will really encourage you to really participate on that very actual subject. Please go ahead, make your voice heard, take the poll question, And that is the fourth one. And we will have one more left. And if you haven't taken the others, please scroll up and then you will be able to participate, so that at the end of the session, we have a big Q&A session where we can discuss that. I will stop here.
Yeah.
Then the floor to the next presenter.
Yes, and if we could advance to the next slide. And I'm afraid we are having some challenges with time. We got off to a little bit of a late start. So let's advance now to the next slide. And Laura Schimpf has kindly stepped in to provide this overview of MIHR's work, Momentum Integrated Health Resilience Project, on rather short notice. So thank you so much. And I believe our session is ending in about 10 or 15 minutes. So we do have some challenges with time. So over to you, Laura. Thank you.
Thanks, Rebecca. And I can do this quickly as I round out the momentums. And as you see on this slide, MIHR is a new award with USAID that actually is a deviation from previous USAID support and US government support, where there's been assistance through OFDA, the Overseas Foreign Disaster Assistance Group, as well as USAID support for helping with system strengthening in building resilience. MIHR is providing the nexus between those two areas and across a very multidisciplinary suite of interventions for maternal, neonatal, child health, family planning, reproductive health, nutrition, immunization, WASH, and other areas. Next slide. So we're really looking at a partnership across different competencies with the prime IMA World Health that has a large civil society presence in many countries and has worked on community and health system development in many countries, particularly in the Africa region, as well as in Asia. And the suite of partners that you see here with JSI Research and Training, which I represent, focusing on the immunization and child health piece, while we have the other partners focusing on the reproductive health, WASH, and other areas of support. So here you see the partnership. Next slide, please. So really what we're looking at with Momentum is, with MIHR, is looking at both national level coordination and technical support to really help in that resilience and nexus area where we know that there are fragile and emergency settings and shocks to the system that interrupt services or that have prevented services from really being able to take hold in particularly subnational areas of countries. So MIHR is addressing that while also now trying to address the very real shock that all countries are feeling around COVID-19 pandemic and how we're going to be able to address both health system recovery overall, as well as the introduction of the vaccines as part of that overall approach to be able to build resilience and bring health systems back under that kind of One Health lens, but also, of course, linking with other important diseases as well for surveillance, zoonotic issues, as well as human and ecosystem challenges that countries face. Next slide. So as part of this, as I mentioned, we're really trying to help bridge between the humanitarian assistance piece and that longer term development piece. Because oftentimes what we find is there's a verticalization between humanitarian and emergency response. Then there's an immediate shift in funding and donor support to more sustainable type approaches. But as we know well, and many of you Scholar Course folks are quite aware of this, there's a large interim framework and strategy and timeline that has to come in between that. And that's what MIHR is really trying to help focus on, is how do we bridge that nexus over time and to help countries do this in a way that hopefully will help build the system in real time, but also realistically, given that health systems can't immediately take over in these areas that have had extreme shocks like Ebola outbreaks or natural disasters or other types of interruptions to the system. Next slide, please. So one of the ways that we're looking at this is also with COVID-19 vaccine, with COVID-19, but also more broadly. Many of you are familiar with the Reaching Every District approach and the 5 components of engaging communities, supportive supervision and monitoring for better adult learning and blended learning, which Geneva Learning Foundation and this workshop are very good for supporting. Monitoring and use of data for action, reaching populations, and now with COVID-19, reaching populations that are not our normal under 1 or under 2 populations for immunization, as well as, of course, the important planning and management of resources issues that we face, but really trying to take RED-REC, which was designed for a more stable type of health system, looking at how that can now be adapted in this transitional resilience lens, because not all of these components can be equally adapted in countries and these subnational areas where the health system has not been functional or has been underfinanced or under-resourced for a long time. So given the vast amount of learning that's come out of the Reaching Every District approach across many of the countries that are represented here, what MIHR is looking to do, and we really welcome your inputs as well, if you have examples of how RED has been adapted in these more fragile or challenged areas where systems have not yet fully been developed, what have you seen in RED adaptation or components of RED that work in that transitional area? Because this is an area that we really want to be able to provide additional guidance, both in the countries at subnational levels and globally, to help bridge that divide between the emergency humanitarian and the more stable systems. Next slide, please. So we have looked at a few different interventions, and we are also now trying to address how this will happen in the COVID-19 pandemic with these types of e-learning exchanges, subnational meetings and engagements, as well as, of course, more traditional ways of blended learning. Next slide. We've also pulled from several different country examples. And as I said before, if you have examples yourselves from your country of where RED-REC has been used in more fragile or developing systems that have weaker health system components, please do share that information with us. We'll be very happy to include that in the tools and resources that we're compiling and the assistance with countries. Next slide. And of course, then in the COVID-19 world, as I was saying, we're really looking at adapting the WHO guidelines, as Chizoba and Meru and others already presented from the global community. We also are looking at how we can work with different ministries of health in countries to adapt this along with this more resilience lens, because COVID-19 has really interrupted health systems, even where they have been more stable. We realize that this idea of bridging fragility into resilience is now an issue for all countries because of COVID-19. So we really want to look at the guidance to be able to help frame that as well as part of the MIHR support in partnership with WHO, civil society communities, IFRC, MSF, and many of the other emergency and resilience partners that are out there that work on the ground and, of course, have close relationships with ministries of health. That from there, I think we move into the last and final poll, and I will hand it back over to Alain.
Right, that was awesome. So let's just go ahead and click on the we will see the last question. So we have option there. So you just have to click the option that fits you, that suits you, and we have 1 minute to do that. So I will let Charlotte announce the good news so that we can have a good question and answer. And please go ahead and use the chat box when you finish your vote. When you finish to vote the 5 questions, please go ahead and use the chat box to type the question you would like the panelists to answer. We will really appreciate that. That said, Rebecca, I think that the next thing to do will be in 20 seconds to share the result with all.
Yes, that's exactly right, Ellen.
I stopped sharing my screen now.
Great. Thank you so much, Chizoba, for keeping everything moving along, and to all of our speakers. And it's been great to see some of the questions coming in here. So, Alain, I think it's over to you now to show the results from the poll questions. Are you able to do that?
So,
Charlotte?
Or Charlotte? Perhaps Charlotte?
Alain is muted. So normally, if you are on the panel, you may not be able to see the poll unless you take it, but I'm able to see, and the participants in the poll are also able to see. So for the first question, it was 25% providing training to all health workers, and 28%. Then it was apart from the other, there was kind of like a division, an equal division amongst the responses, with providing training to all and ensuring the technical quality of training, sharing 27% each. And then for the second question, it's 68% local community and religious leaders. So majority of those in the room that took that. For the third question, 47% of the votes went to public-private alliance for communications to restore confidence and generate demand. And the next was partners for logistics for vaccine storage and distribution. That's 28%. All the others were below 10%. And the next, which resources? The first was 32% webinars or workshops to share and learn from peers and experts. Training videos on how to implement programs you wish to adapt. That's 28%. And peer-reviewed publications of promising interventions, 26%. For the last question, overwhelmingly 50% engaging with the community. And then the next up was monitoring and use of data for action, 21%. Reaching all eligible populations, 13%, the others 10 and below.
Thank you very much, Charlotte, and thank you so much for addressing the challenges of, in real time, getting responses to poll questions and providing that very nice summary of the findings. Alain, are there questions that you have seen come up in the chat box that we should address? And are there questions now from participants that we would want to take on? So over to you, Alain.
Yes, it was just a comment by Brahima Kabore, who was saying that seems like integration is the way forward. I think that integration could drive us to effectiveness. So he was basically comment on that this Momentum project is a kind of services integration. And he was wondering why it seems like it's just a project supported by USAID. Mm-hmm. What about the other funders? That was the question.
So maybe I can just take that one for a moment. He is exactly right. What we have been describing in this session today has just been about the Momentum projects, which are supported by USAID. But in every country where we will have the opportunity to work, we will work and link closely with other partners, other people who are also supporting immunization and the health system in the country. I think it's a very interesting observation and a very appropriate observation about the need for integration and looking at immunization within the overall context of not just the health system, but the community as well. So I think those are very well taken points, and thank you for them. Again, I think that we will be working very hard in the countries where we work to make sure that we are partnering closely with others, even as our own funding through Momentum is specifically from USAID. Thank you.
Yeah, thank you very much. Because we have a small extension, I would like to go back to the first question commented by Charlotte. If you see my screen now, you will see that the first question has something really interesting in terms of what we're doing here, the capacity building. You can see that we have equal participants saying that they really want to provide training to all health workers. We need it, 26%, but also ensuring the technical quality of the training and providing training orientation to people other than health workers. Can someone in the panel comment that I find that it's showing this kind of interest that we are having for capacity building, tackling exactly, equally important topics that are here. And you can see on my screen.
Unfortunately, I can't see your screen at all. So that's
I'm happy to come in on that.
Go ahead.
I do think it's a very important question, and I think across each of these momentums, there's an aspect of capacity building and competency transfer that we really want to have as a focus, both the cross-learning that MGCL will provide, the training and competency building to help with resilience and moving from emergency to more sustainable and stable systems in subnational geographies in countries that have had challenges with their systems. And of course, engagement of private sector, where we know private immunization clinics and others can provide services, but they may not have had the same adjustment to training and capacity that the public sector program has. But all of this also needs to be done in realistic ways with the health workers based on their time and their pre-service and their ability to do the work while also engaging communities, community health workers, and understanding how the system works, which are the components of reaching every district also. So I think for each of these momentums, this is a key area of importance, and really that subnational learning from folks on the ground is critical.
Yeah, if I could just add to that, I think we also have to recognize that everything may not be perfect right at the start, but we will have the opportunities to improve as we go along, and recognizing that, the situation with COVID-19 vaccination will be changing over time. I think it's going to be very important for us to capture the kind of learning that actually Geneva Learning Foundation has been supporting so very, very well, to share what the experiences have been, and not just acknowledge the problems, but also build on the successes, so that as we move forward and look at not just providing training, but also reinforcing that training continuously, that there's the opportunity to improve as we go along.
Yeah, I completely agree. And what's interesting to me again is the poll about what's your top choice for how to convey this information or training and everything. And it's interesting that webinars and workshops came out tops, followed by training videos before peer-reviewed publication and case studies. I think what is really speaking to me is that we need to really embrace the innovation that has come with online webinars and all, and as well as short videos, because those are the ones that really go far. So as we are thinking about retooling our training enterprise, we need to really adapt the means and the modes that are generally popular for people to converse, for people to communicate. Let's use those means to push out our trainings as well. So
great point.
Thank you so much. Thank you, Tizoba. Thank you, Laura and Rebecca. I'm sending back the floor to Charlotte for the closing remark. And thank you for the extra time. That was really appreciated.
So I'll actually just want to thank you all for coming today and for the excellent presentation. I'm sure everyone in the room, from the comments you actually got, they got something. And I do hope that in the nearest future, we could have more of this, another event to get to know momentum projects. So I'll just be inviting everyone in the room now to just go directly to the stage for the plenary session on the Global Council of Learning Leaders. So I really want to thank you, Chizoba, Meru, Rebecca, and Laura Alembles for being here. And we look forward to another opportunity. Bye.
Bye. Thank you.
Bye-bye.